Hi Terry, I'm Sydney. I'm going to be the nurse today. I'm just going to suction out your trach here. So I'm going to wash my hands, provide privacy, bring the bed up to a working level. I'm going to gather my supplies. Can you tell me your last name and date of birth? And if you have any allergies, and then I'll double check it with the band. I'm going to double check the order and then review the procedure. And then I'm going to place the patient in a high Fowler's position and listen to the lungs quick. Breathe in and out for me. And then I'm going to place a pulse ox on the patient, and I'm going to explain the procedure. So you have a lot of secretions in your trach, and I just want to suction them out to get rid of all the excess and then thin out the rest of it to help you breathe a little bit better. So I'm going to wash my hands, and then I would put on PPE as needed. And I'm going to open my sterile saline, leaving the cap up, and I'm going to label it with the date, time, and my initials. And I'm going to put this towel on the upper chest. And I'm going to inspect the packaging for any defects and make sure it's not expired, which it's not, so we're good. Wash my hands. I'm going to open it. I'm going to put on my sterile gloves. And I'm going to open that. I'm going to remove the catheter and then wrap it up. And this will be my sterile hand, this will be my clean hand. So I'm going to lube the catheter and then pour some sterile saline. Alright, and then I'm going to hook it up to suction and remove the oxygen. Or I'm going to increase the oxygen first to 10 liters per minute or more. And then the suction will be on 80 to 120 because he's an adult. All right. So then I'm going to remove the oxygen. And then thumbs up first. And we're gonna place the catheter until you feel resistance or until the patient coughs, and then you're gonna remove it 1/2 inch. And then you're gonna apply suction and go in a circular motion. And I'm gonna continuously monitor the patient for any signs of distress, tachycardia, or any signs of cyanosis. Then I'm going to apply suction and clean out the catheter. Replacing the oxygen every time in between suction. So then I'm going to take it off. Thumbs up as I go in. Apply the suction, resistance, take it out 1/2, and then do it in a circular motion. And then reapply the oxygen. I'm going to suction the sterile saline again. And then I'm going to turn off the suction, turn back down the oxygen to the prescribed amount. And then I'm going to wrap it up into my gloves and remove my gloves. And then throw that away. And I'm going to take this off. And then listen to the lung sounds again. Pulse ox is still on, so I'm gonna look at the pulse and oxygen sats as well. Everything looks good. I'm going to wash my hands again, and then I'm going to document the procedure. I'm going to look at the heart rate, the respiratory rate, and then I'm going to document the date, the time, the secretions, so the odor, the consistency, the amount, and the color. And then I'm going to document the pre and the post assessment and how the patient tolerated it. I'm going to lower the bed back down, hand them their call light, call, don't fall. If you need anything, my name's Sydney. And then wash my hands and I'm done.